welcome to another episode of The Soul of Business with Blaine Bartlett. I am your host, Blaine Bartlett. There's something that happened about, well, I'm not going to date this because this is, no telling when this actually gets broadcast, but a number of months ago, there was an unexpected occurrence that happened with my wife. And we've come to call this an unexpected opportunity. And it was a health issue, a very significant health challenge. But the opportunity that is embedded in it is what I want to look at today. And it has been an unexpected opportunity. It's a life and death sort of a scenario, which is interesting because a lot of things nobody's getting out of here alive. Life itself is a death sentence in one sense. But the idea of being able to take events that happen to us, and they happen to us, events happen to us, sometimes out of the blue. If we have a mindset that's organized around opportunity, that things happen for us, they don't happen to us, that changes the tone and tenor of a lot of things. Now, this is true both at a personal level. It's also true for a business. My guest today is Dr. Andrew Kadar. And he's a physician at Cedars-Sinai Medical Center. He's a diplomate of the American Board of Anesthesiology and a fellow of the American Society of Anesthesiologists. Yale University Graduate School of Medicine, completed his residency at Stanford, Harvard University, Mass General. He's renowned. And what's interesting here is he got a shocking diagnosis that resulted in a very interesting journey for him that culminated in part in a book that he wrote called Getting Better, a doctor's story of resilience, recovery, and renewal. Brand new book, just out this. Andrew and I are going to have a conversation here about unexpected opportunities. I think that would be one way to talk about this. And Andrew, I want to just welcome you with a fulsome heart here to the show. It's a pleasure to have you on the show.
Thank you very much. It's a pleasure to be here.
You got surprised.
Sure did.
Yeah, you were newly married and life was going along pretty well. I mean, You're rocking it, and you're an athlete. You're top, tip-top health as far as your own assessment was concerned. And then, bam, something happened. Why don't we just thread that needle first of all, and then see kind of where it takes us? Because I want to look at just kind of the nature of soul in all of this as we have our conversation. So, what happened?
I'd been healthy all my life. I was a college athlete. I was on the UCLA gymnastics team as an undergrad, and I maintained good health. I ran lots of 10Ks, worked out regularly, never smoked, had no high blood pressure, had a great family history. I went hiking with my father when he was 86 in the Canadian Rockies, and he lived to be 94. So I had no expectation of anything amiss happening. But one day I'm working out in the gym, and about 9.5 minutes into a pretty intense workout on the elliptical, I start feeling some burning right under the breastbone. Now, I stop and it goes away. Now, I know I don't have heart disease, but I'm not feeling well that day, so I'll knock it off. 3 days later, I go back. The exact same thing happens about 9.5 minutes after starting this exercise. So I think, okay, what the heck's going on? It goes away. I start up again. In about 2 minutes, it happens again. Okay, now this time I say, I don't have heart disease, but what would I tell anybody else who had the symptom history? And then the answer became obvious to me. Now, there's a thing in medicine saying that denial is not just a river in Egypt. And
say that again.
Denial is a river in Egypt.
Interesting.
And it goes for basically people don't want to face unpleasant news. And I was well aware of denial. I mean, it's something I deal with as a doctor. And I knew that the most characteristic presentation of coronary artery disease is exactly the triad, the three things: pain under the breastbone, comes on with exercise, goes away with rest. So it was textbook familiar to me, but it's very difficult to be objective about yourself. So I did exactly what other people do when they have this presentation, and just went into denial. But I got over it by separating it from myself. And I think that's a very good technique when faced with a medical symptom, or for that matter, maybe any other crisis, is what would I advise a good friend who had this same situation happen to them? Because then you take it one step away from yourself. And I think that makes it a little easier to deal with it. And then once once I had that, I had a workup and it was surprisingly bad. The results, I had three vessel coronary artery disease, and including a lesion that's known as the widowmaker, which is a blockage in the largest arteries feeding the heart. And so I needed to have fairly urgent open heart surgery. When that happened, I thought, okay, I'm going to have the best recovery in the history of open heart surgery ever. And part of that was from my background. When I was in a gymnast, my teammates would get injured and they'd be told it's going to take you 6 weeks to get back to start working out. In 3 weeks, they'd be back in the gym doing their routines. I used to think that doctors routinely exaggerated the amount of time it would take to recover, but I didn't realize that I had an atypical sample. Young athletes are pretty highly motivated and better shape than average. So, but nevertheless, when this happened to me, in my mind, I was still that 20-year-old gymnast. And so, as it turned out, I learned another lesson here is to expect the unexpected when you have a major illness. And I had a number of setbacks, a number of complications. Some I knew could happen, but they happened worse than I expected. And some I didn't even know could happen. So it's so expect the unexpected when you have, I suppose that's true in life in general and probably true in business.
Yeah.
But you can get surprises. And some of the surprises are things that can go amiss, but you don't necessarily expect it to go amiss in your case. And some of the things are things that you didn't even realize could go amiss. So that's kind of what happened to me. But I think in reality, mine's a hopeful story because in 12 weeks, I was able to go back to work and went back to full-time practice and practiced for another dozen years and am in good health now. A year ago, I was hiking at 7,000 feet to see mountain gorillas in Rwanda. So a full life is possible after a major illness.
Yeah, the story is there's a number of things here. Yeah, the expect the unexpected in a business context. I'd call that a black swan event. I think COVID was a great example of that, just for people's recent memories. Yeah, and for businesses, I mean, it just pulled the rug out from a whole lot of businesses as a consequence, and we weren't expecting it. The other part of it is denial. I often joke that for a lot of people they think denial is a river in Egypt. It's actually not. It's what you're describing here is something that every one of us will fall into when faced with an unexpected occurrence. The journey that you embarked on, how did it, as a medical professional? I mean, your training, and I'm on the teaching faculty of the American Association for Physician Leadership. And so I've worked with physician leaders a lot, and very familiar with just the way that physicians are educated and have actually developed their practices, so to speak. And it's pretty rigorous and it's pretty structured as well. And all of those things kind of layer in to where in a lot of the docs that I actually have coached and worked with, I meet initially the facade of doctor before I get to the person behind the facade. Now, that's just my language of describing it. But in your journey, if you did find a way to reconnect with what it meant to be a human being and not a doctor in life.
Of course, as soon as you have a diagnosis, you feel very, very vulnerable. In fact, even when you check into the hospital, you feel very vulnerable. In my case, took off my doctor's badge. I took off the paraphernalia of a doctor and put on a patient gown. And I was in a very different position right away, a much more vulnerable situation. But I felt that being a doctor did help in a way that I could describe my situation in a way that doctors and nurses would be receptive to them. And I think at every stage of an illness, there's you need to describe what's bothering you, and then the question is, how do I deal with it?
Mm-hmm.
So that's the approach. And when you go to a doctor, they want to know what the chief complaint is, so that they can deal with the chief complaint. So at different stages of my recovery, I had different chief complaints. Initially, it was right after surgery. Pain is the thing that bothers people the most. But then that passes pretty quickly, and by day 2, it's more. In my case, it was an unexpected thing. I had difficulty swallowing. Now, I wasn't aware that that's a potential complication of open heart surgery, but the ENT guy that came in and looked at me informed me of that, and that reassured me, because being being ambushed by something unexpected is particularly difficult. But then there were complications that I was aware could happen, but I wasn't aware it would happen to the degree that it did. Now, in my case, it happened with hiccups. Now, hiccups are usually a minor nuisance. But
Yeah.
in medical school, I learned that some people get hiccups that go on for weeks and months and years. And some people even died of respiratory failure when their diaphragm became exhausted. Now, today that wouldn't happen because you'd be put on a ventilator, but it can be much more than a minor nuisance. And I knew that any operation that in the area that can irritate the diaphragm can cause hiccups. And usually the drains that you have and that you get in surgery can irritate a portion of the diaphragm, and that can cause it. But as my drains came out, my hiccup started. At first, it was just a minor nuisance, but as the drains came out, it became more and more. And I had 4 drains. When the final one came out, it was like the proverbial finger in the dike. It just unleashed a staccato of hiccups that just wouldn't quit. It would be hiccup on top of hiccup on top of hiccup, just hic, 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 hic. It would go on, and then it would stop a little bit, and then it would start up again. And this went on for a day and a half. And there are lots of ways of treating hiccups. Some of it are mechanical, like swallowing grainy sugar. But I couldn't swallow fast at that point because of my swallowing problem. Another is to reach up as high as you can and swallow real hard. Having had open heart surgery, having the breastbone broken, you can't reach up above shoulder height. So physical things were out. So I needed pharmacological treatment. And the first things that my doctors tried, which were sort of the mild treatments, didn't do a thing. And it was about a day and a half before I finally got medication that stopped the hiccups, but also put me to sleep. So then they had to back off to try and get to the level where I would still be somewhat awake, but not hiccuping nonstop. And then that medicine was eventually tapered, and the problem went away. But it was the way it came on. It was unexpected, and a number of these things came. I got thrombophlebitis, which is inflammation in one of the veins, and it just had. I had a series of complications that were more than usual, and that's actually, it was one of the things that I was very frustrated by, because I think, a myth in medicine that doctors make poor patients, that they get more complications. And I was going to shatter that, because I was in superb shape and I was going to do everything that needed to be done to get well as fast as possible. And I tried to do that, but nevertheless, I ended up staying several extra days in the hospital, longer than
Yeah.
expect the unexpected.
Nature has a way of saying, yeah, not so fast.
Unfortunately, yes.
Hi, I'd like to ask you to do something for me if you wouldn't mind. If you like this episode, I'd like you to not only subscribe on your favorite site, but I'd also like you to give a rating. Ideally, a 5-star rating would be greatly appreciated. But I think more importantly also would be just some comments. That helps with the algorithm, and it helps build the audience with this. And more than anything else, if you could invite somebody else to listen, just share this episode with a friend, with a colleague. And I'd like to see how we can grow the soul of business. I think it makes a difference. Thanks. Well, I'm going to circle back here a little bit. Yeah, one thing that you said was, you took off your badge, you took off your white coat, and the vulnerability was the word that you used. An old mentor of mine years ago, Dr. Will Schutz, said, people connect through vulnerability. And it took me a while to really understand what he was talking about. And I added a little addendum to him to that phrase after some time. And people disconnect through certainty. And it's that connection with vulnerability or via vulnerability that allows for things to happen. And yeah, as long as certainty's in the place, there's not a whole lot of room to dance. It doesn't give people an opportunity, or the environment even an opportunity, to connect in a way that's useful or beneficial. Can you talk a little bit about your experience of being vulnerable?
Yeah, it was, I feel very comfortable in the hospital in my normal setting.
Right.
But as a patient, you're not, you lose a lot of autonomy for starters. You essentially have to do what people tell you to a very large extent. And they're doing it for your best interest, and you're aware they're doing it for your best interest. But nevertheless, it's an uncomfortable feeling, or it can be an uncomfortable feeling. And I think one of the ways of getting around that is to go to a hospital and go to doctors that you can trust. And I did have an advantage of that because all the people I chose to take care of me, I knew personally, and I knew that they were very capable. And I think any other patient needs to do that too, to seek out people that they can trust and know that they're being taken care of as well as you can be taken care of.
Yeah.
So I think that was an important reassuring thing for me. But you also need to communicate well with these people. And I did have that issue a little bit. When I had my swallowing problem, I would mention it. But it didn't seem to register how much it was bothering me. I mean, every meal was basically a struggle of coughing and sputtering and not being able to swallow things. And I don't think I fully communicated that initially. And I really needed to do that in a clear enough manner. I ended up actually calling one of my gastroenterology colleagues to ask him for advice on this, which is kind of outside what you generally do. But of course, other patients can do that as well. They can contact other physicians or have family members contact other people to get advice on what might be a way of approaching things. So you can take some initiative. I mean, I think you have to be your own advocate, and of course your loved ones can be your advocate along the way as well.
Exactly.
There are things that bother you more perhaps than bother other people. And actually, one of the things that I'm not particularly proud of that happened along the way was one day I woke up and I had a wristband that said balance risk. Now, I'm a gymnast.
Uh-huh.
I pride myself in my good balance. It'd be like telling a musician that he's tone deaf. So I was outraged. Why do I have this on? And the nurses were concerned. No, don't get out of bed. I said, look, I can stand on one leg. I can stand on my toes. And they said, no, don't do that. And later I found out that this was actually a band that they put on any patient that goes under anesthesia. It was something new the hospital initiated, so I wasn't aware of it. Once I came back to work, I realized every one of my patients had one of these bands. But I was just more outraged than usual, and I probably shouldn't have overreacted the way I did. But after this was a week after being in the hospital, it does wear you down, and I think people make allowances for your behavior, but still you need to be considerate of your caretakers. And that's I think one of the big points that I make is that you do need to be considerate of your caretakers because it is a stress on them. I think for my wife, this was a major surprise and a major stress. Once I was out of the ICU in the regular room, the hospital allows patients to have one family member stay with them overnight, and that means it's in there's a small cot because there's room constraints, and it's pretty uncomfortable. And the first night that I was out of the ICU, my wife stayed with me, but she didn't get any sleep at all because there are all the noises of the hospital, the beeps, and the people coming in to take my blood pressure, to draw blood early in the morning. And we both realized that it was in both of our best interests for her to go home at night and try to get as much rest as possible. One, because it's going to be easier for her because she's not going to get exhausted. And there is a thing called caretaker exhaustion syndrome.
Yep.
And it's going to be better for me because she'll be better able to help me out and be supportive of things that I need. So you do have to be considerate of your doctors, your nurses, and your other caretakers like your spouses and family members, friends.
Yeah. Yeah, I've certainly run into that with my own experience. When I'm talking about an unexpected opportunity, that can take a number of different forms. And in your book, you actually talk about this a little bit in terms of how a health challenge can alter a person's, not just at the meta level, alter a person's life, but also my sense of self and the narrative that I create for my future. In your experience with this, with you, did your sense of, how did your sense of self, because I'm assuming that it in fact was affected here because you actually write about it. The sense of self has actually shifted a bit here. And I kind of, laugh a little bit. I'm a former university gymnast as well. And I was, at a gym working out the other day. And I noticed that I was not as flexible as I would have liked to have thought I was still. Back in the day. So my sense of self had to be recalibrated in the face of something that was irrefutable. I can't stretch the way I used to. I can't bend the way I used to. I don't bounce like I used to. Those sorts of things. So for you, can you talk a little bit about how you've come to grips with redefining a future state, as a consequence of a life altering health challenge, but also your sense of self in that picture of the future?
Sure. I think the main thing was that I found out I'm not immortal. And of course I knew that.
Well, that
I
one.
knew that to begin with. I just never felt it before
Yeah.
because when you're going along and being perfectly healthy, you don't think about that. So I think it does allow it allowed me to kind of think in the totality of my life. What do I want to accomplish? What do I want to do with my life? What have I done with my life? Can I do things better? What are the things that I can improve on to basically have a more positive impact on the world, on other people that you come in contact? And so yeah, I think so all those things, but I do try to be. I think I was a fairly positive person to begin with, but I try to be even more positive now. I go out of my way to compliment people when at work, for example. I can't get my job done without lots of help from other people.
Right.
I want to show them more appreciation for that. And it's not that I didn't in the past, but I'm paying more attention to it.
Yeah.
And that's because I want to be a more positive person, a more positive influence on the lives of others. And I think having had kind of a wake up call that this isn't going to go on forever. I can't keep on correcting things that I might have done better before. I better do it better now.
Oh, boy, that's a great one. Yeah. And that really is all there is now. Yeah. Yeah.
Yeah.
And yeah, I was with a couple of the grandkids over Thanksgiving, and and my wife is dealing with some health challenges, as we talked about before the show started. And their sense of mortality is certainly a lot different than either my wife's or my own sense of I've got a lot less runway in front of me than I have behind me right now, I guess is one way to put it. And I was talking to the oldest of the grandkids about this. He was very quizzical. He was going, well, literally, tell me more about that, because as far as I can tell, I'm putting words in his mouth here, but as far as I can tell, I got the world's my onion here. I've got all kinds of stuff in front of me. I'm just going to start peeling stuff away and see what's there. I don't have to worry a whole lot about consequences at this point in time. I'm going, well, okay, let's back that truck up just a little bit, because there are consequences to choices that are made. And to your point here, appreciation, and I love your use of that word. It's a recognition that somebody has made a difference in my life, and then there's an that act of appreciation, appreciating, goes a long way towards cementing a relational bond, which helps me define who I am. It helps me, begin to and continue validating I'm a good person, as an example, whatever that identity question in play is. As we kind of begin to wrap this up here, if there was one major takeaway from your experience with this that is continuing to inform how you live today, what would it be?
I think I want to make a more positive influence on my environment. And part of the reason I wrote the book was that I felt I learned a lot from this experience.
Mm-hmm.
And I could explain it from a dual point of view of a patient and a doctor going through these events. And I thought that that would be helpful for other people. And that's why I went to the effort of writing a book about it, so that it would be a positive influence and help other people who are going through a similar kind of a crisis.
Great.
And going forward, I want to continue to be a positive influence on other people and to do things that would be helpful. Now, it's a matter of degrees. It's not like I wasn't thinking about that before, but this is a wake-up call that made me think much more about it. And so it's much more in the forefront of my mind to try to be a positive influence and to think when I undertake a project, how that's going to help that.
Perfect. I love that. Thank you. Folks have been listening to Dr. Andrew Kadar. Get a copy of his book. It's out this year, came out summer of this year, Getting Better, a doctor's story of resilience, recovery, and renewal. And as always, I'm going to close off here by just inviting all of us, as you're listening, to find ways in your life to be a center of distribution, not a center of accumulation. And it's an abundant universe, and it works really well when things are moving in circulation. And if accumulation is your modus operandi, you're going to be causing some consternation in the universe, because there's nothing in nature that accumulates over time, long term. Everything eventually gets distributed. And that, I think, is the secret of life. Andrew, thank you so much for being just a fascinating guest. I've loved hosting you on the show.
Thank you very much, Blaine. It's been my pleasure.
My pleasure as well. Thank you.